Hello, everyone, and welcome to today's panel hosted by the Council on Criminal Justice. I'm Abby Walsh, the Director of the Council on Criminal Justice, here with just a few housekeeping notes before we begin our program. We are joined today by nearly 400 participants, so to ensure a quality experience for everyone, all lines will be muted, but we want to hear your questions. To submit a question throughout today's session, please use the Q&A box at the bottom of your screen. You're also welcome to email us at info@counciloncj.org throughout today's meeting. With that, I'm pleased to introduce John Tilley, Council Senior Fellow and former Secretary of Kentucky's Justice and Public Safety Cabinet. John, the floor is yours.
Well, thank you, Abby. And we, first of all, hope you're all safe and well. We're so glad you're able to join us. I think nearly 500 people have now registered, and thank you for that overwhelming response, for being part of this timely and important discussion as well, with a distinguished panel of leaders like yourselves. Again, I'm John Tilley, a Senior Fellow at the Council, and about that Council, a quick word about us first. We're an invitational membership organization, a think tank, serving as a center of gravity for policy and leadership in the field. And we at CCJ think this web call embodies that mission, to be guided by the facts, the evidence, and ultimately what is just. So this call is designed to connect leaders across the criminal justice spectrum, to serve as a forum for candid and honest discussion today about those aforementioned facts and evidence. It's the first in a series you'll hear more about, and it's from the front lines today, from law enforcement, engaging people at the tip of the spear. These folks are no strangers to the first response or challenge, but it's now apparent that none of us have ever seen something quite like this, which is why it's critical we connect and communicate, and why this promises to be an extraordinary conversation. Tuning in today, council board members and trustees, federal, state, and local officials, leaders from across all these spectrums, law enforcement, the military, corrections and the courts, researchers, the advocates, and many members of the media today. And there's no better leader to moderate and manage us through this conversation than our own Council on Criminal Justice board member, Gil Kerlikowske, former Big City Police Chief, Head of Customs and Border Protection, and White House Drug Czar. Gil, the floor is now yours.
Well, John, thank you very much, and I'd like to welcome everybody. And I'm going to do a quick introduction of this very distinguished panel. I think many of the people that are participating and listening in or viewing today are familiar with this group, this esteemed and distinguished group. Carmen Best is the Chief of Police of the Seattle Police Department. She has been a career Seattle police officer, rising through the ranks, and joined the department after serving in the Army. Jane Castor is the mayor of Tampa, and before that, she was the chief of police. She led Tampa and its community through hurricanes, political conventions, and many other problems. But now she has a very different view of this pandemic, because she is now the mayor of that city. Ben Tucker is the first deputy commissioner of the New York City Police Department. He started his career in the NYPD. He's had a variety of other important positions, including the deputy director at the Office of National Drug Control Policy in the Obama administration. Well, now, New York is really the epicenter of this pandemic. And in the last count that I saw, over 2,000 of their personnel have been directly affected by this. And lastly, but not least, is Chuck Wexler, the long-serving executive director of the Police Executive Research Forum. PERF, as it is known, is a global law enforcement think tank. They have produced reports for law enforcement on a variety of topics, including epidemics, diseases, and pandemics, going back well over a decade. And currently, PERF does a daily email bulletin to all of its subscribers about the virus. With that, I'm going to start with the first question. I'm going to direct it to Chief Best, but then I'm hoping that others will join in. And when we think about the most current topic going on, it's the number of stay-at-home orders issued by mayors, issued by governors, and others. Well, as John was saying, the tip of the spear is going to be the law enforcement personnel. Well, how are they directed to communicate these stay-at-home orders. What is the best way to inform and educate the community? Law enforcement is a trusted commodity by members of the community, and these stay-at-home orders can be difficult. And yet we know that if we're going to, as it said, flatten the curve or actually become quite successful in dealing with this pandemic, these stay-at-home orders are absolutely critical. Chief Best?
Good morning. Thank you, Gil. And first, I want to just thank the Council on Criminal Justice for inviting me to be here with all of these esteemed guests, and a special thanks to Commissioner Kerlikowske, who will always be Chief Kerlikowske to me. But thank you for the question. You know, the issue of the stay-at-home orders, it's one where we are really looking for voluntary compliance for the community that we're trying to keep separated and socially distanced. We're working a lot on education campaigns, getting information out there, making sure that people understand the severity and the impacts of not following the protocols and the request of the governor, and in this case of our mayor, to stay socially distanced and to stay at home. So it's a challenge, but the reality is that we're not going to be able, we have 2,000 employees in a city of 760,000. So the ability to force everyone indoors, even if it's just 5%, you know, it's not practical or realistic. So we're really working with the educational piece, making sure that we put some pressure on social responsibility. I think one of the messages from the governor and from the mayor was this could be your parent, your cousin, your neighbor. So for their sake, you know, stay indoors, stay at home. And we are reiterating that at all times. We have a particular challenge with the parks. As you know, Seattle can be somewhat of a rainy climate, and this weekend, Easter weekend, we're looking at almost 70-degree weather, and people who've been stuck at home for practically 5 weeks. So we have to anticipate the upcoming challenges of a holiday, a beautiful day, and try to get in front of the messaging early, not just as a police department, but as a city, a unified front to keep people educated about the importance. We're not over the hump yet, and we need to keep pushing that information out. And then additionally, we have our officers and our employees and our staff modeling what we're asking people to do. We're maintaining social distancing. We're using our personal protective equipment when it's required. We're wearing masks out in the public. We're putting that out as well. And as the CDC guidelines change and evolve, we're quick to change and evolve with them, model that behavior, get information out, and stay in tune with all of our elected officials and other organizations on messaging. I mean, we are dealing with the reality that, you know, this is something people are going to have to volunteer to do and take social responsibility. Additionally, another issue is that, you know, the jails, as many of you know, are not taking as many people, and they're having to practice social distancing and a little more guidance on who can go in and out of jail. So even if we could do it, which we can't, the facilities and the ability to do so don't exist. So that's the approach we're taking.
Thank you. And could others jump in?
Yeah, Gil, this is Ben. I'll jump in. I think Carmen laid out almost like the blueprint for how we're dealing with this particular challenge. Certainly voluntary compliance is at the top of the list, because the last thing we want to do is engage in enforcement activities here. And to Carmen's point, you know, we have 36,000 officers plus, but we have 8.6 million people. And so there's no way you can enforce your way out of this. You've got to, you know, you've got to get voluntary compliance. You've got to give people information, explain to them, and hit home this idea, the notion that social distancing is going to be a huge part of the solution to this virus. And so, you know, with the messaging coming out of, coming from our Department of Health, our health commissioner, coming from others, elected officials, clergy around the city, we're pushing out a lot of information to them. And those are some challenges that we've seen with respect to certain religions, and who when they have deaths occur with prominent members of that religion, they all gather, and so that's a delicate challenge to meet. So we have to deal with those challenges as well. Carmen mentioned the idea of our personnel as well. We probably 75 to 80% of our non-essential staff are working at home, out of the office and out of harm's way. And our offices, the same thing, are wearing, those that are out there, stepping up and being out there, trying to message to the public, to give them the message as well. And to help them, in parks in particular, send a message. We've used leaflets. We've used announcements over our radio car announcement systems. All of those things, whatever we can do to make sure people are in compliance, and that also goes into the enforcement realm as well. There are lots of non-essential businesses that ought to be closed, bars and places where people gather for entertainment as well. And so we are policing those organizations, those entities. We're visiting them. I mean, we make thousands of visits on a weekly basis to all these places to ensure that they are in compliance. To those that are not, we will issue a summons and so forth. So there's some low-level enforcement, but the real challenge is, and the real hope is, that people get the message, and many have here in New York City.
Good. Mayor?
Well, I echo exactly what's been said. Also, getting that word out through a variety of ways, through social media. We're using snipe signs. We're doing chalk paintings on sidewalks. Just any way that you can get that message out there. One of the things that I'm focusing on is the personal responsibility. And when people ask about the enforcement aspect, I tell them that you really shouldn't get to that point. Everyone should understand their level of personal responsibility in the distance separation and ensuring that they're not passing on this virus. One of the things we even did to Chief Best's point about, people being inside for so long and the frustration. And so we're actually doing a dance party every evening at 6 p.m. We have 6 radio stations play the same song, and everybody comes outside and, in their driveways, and they're filming that and sending it in. So, any way you can bring your community together while we are apart is sort of our tagline. One of the things I'd like to bring up, and the data hasn't borne out in our community in Hillsborough County. We're 1.4 million. We're about 400,000 in the city of Tampa. And we, like everyone else, don't have the ability to test to the level we should. But seeing a lot of these other cities and the disproportionate effect of this virus in our Black and brown communities is something that we're trying to get out. The significance of the distance separation in those neighborhoods is critical. And we're not seeing that in the testing because we're still using those parameters plus we don't have the supplies, but the parameters that don't ask about the comorbidity as much. So we're trying to do that, getting the word out to everybody. But our law enforcement agency is led by Chief Brian Dugan, who is incredible. And we have a great relationship with our community. And so we are focusing on education and encouragement.
Good, thank you. And Chuck, you have this national and really international perspective, having talked to the Met, the Scottish police, the Canadian. I know you did an interview with Canadian chiefs. What's your take on this?
Well, it's a matter of, we have 18,000 police departments, and as you mentioned, Gil, countries that have had some kind of experience in this. Yesterday we were talking to the Israelis, for example, and last night was Passover, and this weekend will be Easter. So those are traditional holidays that people get together, and they have very strict guidelines. No one is to be on the street. And they learned this 2 weeks ago. There was some Jewish festival, Purim, and they had a bunch of people that came out and infected a number of people. That's what happened in New Rochelle. This one individual, went to this service, and then a number of people got sick. So, one individual can have this profound impact. But one other way to look at this too is reaching out to those vulnerable populations. So for example, in Chicago, what they're doing is they're taking the lists of the elderly that they have that they would use for, say, a big snowstorm or something, and they're going down that list and checking on those people to see if they're okay. In Mesa, Arizona, where they put people at home, workers at home, librarians, they've said, you can't do your job as a librarian at home, so they have them checking on the elderly. In other cities, the police are playing this role, especially with the elderly, of bringing them things, bringing them groceries and so forth. So, I think this is a real opportunity for departments to be creative and to look at the vulnerable populations and figure out how they're going to make it. They're very afraid. They're afraid to go to the grocery store, and I think there's a real opportunity for police to play a more proactive role. So rather than warning people not to leave, how do you deal with people who have to leave and are afraid?
Thank you very much. Mayor, let me just ask you, I know that all of these departments have been working to reduce arrests, and that those that run confinement facilities are also looking at having to reduce the population. And it's a delicate balance because you have to be concerned about certain amounts of crime, certain levels of crime, but also the virus within those areas. How are you as mayor working with the courts and prosecutors, the state attorney's office and others in dealing with trying to reduce the jail, help them reduce the jail population, but confine the virus?
Right. We're very lucky here in Hillsborough County because we have such strong working relationships among all of our first responder community and our law enforcement and court system. And so early on, so in Florida, the way that things are run, or the counties have responsibility for all jails. And so the sheriff had released a number of low-level individuals in the very beginning of this virus and this outbreak to ensure that they had a smaller population and more room. And in the jails, they're used to having individuals come in with communicable disease. So they have a pretty robust disinfectant system within the jails, understanding how quickly it can spread in those locations. We also got with, not necessarily on this particular level, but I think is important too, is the sheriff's office is responsible for doing all evictions. And so got with the chief judge early on and put a moratorium on all evictions so that no one has to worry about being put out of their homes. And then working with our police department here, ensuring that we first of all are tracking all of those calls for service that you think would increase. For example, domestic violence when everybody is cooped up in the home. And we actually have a small decrease in the number of our calls for service associated with domestic violence, which is rather surprising. But, doing all that we can to avoid arrests that could be, avoidable or provided with a citation and sending someone home with a notice to appear, as opposed to bringing them into the courtroom. The courts, all the jury trials, all of that has all been postponed on a state level. And then as far as our county court, they're still working on some of the systems. The only court that they want to hold are ones that can be done through a system like this, a telecommunication in the dealing with the issues that have to be dealt with. Otherwise, it's sort of a hands-off policy as much as we possibly can do that in a community and keep all of our citizens safe.
Sure. Others?
Yeah. Go ahead.
It's just a couple of comments in that regard. I mean, it is a challenge. And so here in the city in New York, same concerns around Rikers Island in particular. So we've been involved in discussions along the way with respect to decisions around that they wanted to move some people out out of Rikers so that they would reduce the risk of the virus spreading. We didn't object to that. There's some people perhaps that we would be concerned about, but certainly what takes precedent here is this idea of how do we keep people safe. And so that is taking place. The other concerns that we've had, I mean, and as the mayor mentioned, the courts here in the criminal court system postponed all non-essential functions as well here in the city. And so our Criminal Justice Bureau, which is our liaison to the Office of Court Administration, has had to work with them to figure out how we're going to arraign prisoners, because we're still making arrests, although the numbers are way down. But nevertheless, if you're making arrests in this environment, you have to be concerned about those who you're arresting. So the officers are coming into contact with people who they arrest. If those individuals are exhibiting any sign of not being well, then we will, if they need hospitalization, we'll take them to the hospital as right away. But if not, but they still have symptoms, not necessarily COVID related symptoms, we will process them in a separate. We set aside two locations, the Midtown Community Court as well as the Red Hook Community Courts, and those are working with the Office of Court Administration. Now the venues for any arrests where the prisoners have to be, we are concerned about their condition, medical condition, physical condition. So we process them there. And then we've had to adjust as well. Arraignments can't stop. We've got the criminal procedure law to worry about, so those things have to happen. And we've worked it out with the Office of Court Administration, again, to do online arraignments through computers, just as we're communicating here. They can be arraigned in the location, and we're processing all prisoners that have no health conditions at the 100 Center Street in Lower Manhattan. And then that's the way we've been managing this process. So it's working out. It's working well, but it is one of those circumstances that among many that have us in uncharted territory.
Chief Bess?
Yeah, many of the same responses from Ben and from Mayor Castor, but also the additional challenge that we found is that unlike maybe there in Tampa, we've seen a pretty large increase in domestic violence calls for service, up 23% in the city. And so we've had that extra challenge because we're trying to practice social distancing with our victim support team that you created, Chief, but we're trying to make sure that we keep those folks as safe as possible. So we've had to really work at how we can get services to the victims, special contracts with the hotels and transporting them, just additional effort, even under these circumstances, in dealing with our domestic violence victims, because we have seen a rather large increase. And we have all the same considerations that have been previously mentioned, jail capacity, the ability to keep the detainees separated and safe, as well as making sure our officers aren't engaging unnecessarily, I would say, with, overly with low-level issues. So we're really trying to focus on, life safety, victimization of people where there's harm or danger or serious property damage before we make an arrest. And fortunately, our jail coordinator was one of our former police chiefs, Chief Diaz. So he's been very proactive and having a lot of conversations with us. And we haven't precluded making arrests. Officers still have discretion, but we are asking them to be thoughtful about it.
Good, thank you. Let me ask you this, if in any of your careers there was anything that helped you prepare for dealing with something like this. And are you coming across with new partners, either NGOs or other partners in government? I know the health department has been a big partner on your opioid issues in all of these communities that brought police and health closer together. But did anything prepare you for what you're dealing with today? And are you finding allies or new help?
Well,
I would say, go ahead, Deputy.
I was just going to say that we have we've had some great partnerships within the city, but still some of them, there's an ebb and a flow sometimes. So with the medical profession in particular, since 9/11, when 9/11 occurred, we had liaisons and programs that where they provided, like New York Presbyterian Hospital provided services almost exclusively to our folks working at 9/11 and who needed assistance, mental health care, and all of that after in the post 9/11 era. And we reconnected with them today in that same vein last year with respect to our suicide challenges, but the services that our officers need around mental health still sort of bridge that gap. But with respect to other partners, there are lots of partnerships, public and private. As always, we've been, PD has been very blessed with having corporate clients of corporate offer assistance. And so, hotel rooms for our officers, for example, who live with people who may be at high risk for COVID. And so it's a challenge if you live with that person. How do you practice social distancing so that you don't bring home anything that might impact that individual and cause them to become ill? So having an opportunity to have that officer stay in a hotel room away from the and not have to go to their home where they have an elderly parent or even young children or whatever. So those things have worked out well. And then I think partnerships across the board that we've had, though not new, but very much people stepping up to help our clergy across the city. And they've been involved in the messaging, been involved in helping keep the morale of our officers up, which is a critical part to this whole equation, making sure that the officers are getting what they need, but also in terms of moral support is a very valuable thing.
Thanks, Ben. Mayor?
I would suggest to the audience is don't wait for anyone to call you. This is a unique situation we have here in Florida. It's usually a hurricane that hits and it hits a location and everyone comes to your rescue, and there is no cavalry here. And so, you make those necessary relationships. I call every day the heads of all of our local hospitals, the head of our health department. We had an excellent partnership with Catholic Charities and set up a homeless shelter for 100 individuals, putting them in tents, getting them medical care, showers, laundromats. The chief said that he's going to make the occupational nurse the employee of the year, although she doesn't even work for our department. She has worked with all the officers and their anxiety, well-founded anxiety about this, and really calmed them and comforted them and made sure that we have a minimal number of officers in quarantine and that we're being tested. And to date, out of 1,000, force of 1,000 sworn, we only have 2 positive cases so far. So I would suggest to everyone is call those individuals that are important and look to the best practices from other cities around the United States.
Gil, just to tag on to what the mayor said, one big issue which the police are really playing a proactive role is the homeless issue. If you look up and down the West Coast, but also around the country, this is a population particularly at risk. And seeing departments on the West Coast moving large numbers of the homeless into some kind of shelter. And that's particularly daunting because you don't want to take them from one area and put them into another area and put them more at risk. But if you just leave them out there, it's a huge issue. And departments are really stepping up to do that. The mental health aspect of this is also huge. Some police chiefs have reported the number of suicides has significantly increased. I think we can expect that. And so what can you do in the community? I saw Governor Cuomo did something really interesting is he asked for volunteers, from psychologists who'd be willing to donate their time. People want someone to talk to during this time. And something like, I think, 6,000 psychologists in New York stepped up. So I think the homeless issue, mental health issue, the elderly, the at-risk population, all of those things. And as Commissioner Tucker said, using the clergy. I mean, as I said, and this weekend with Easter coming and so forth, I think it's far better for ministers and priests to be asking people to stay at home rather than the police to do that. They're the logical ones to do that. So I do think, Gil, as you pointed out, there's an important role for these traditional allies of the police to really work in a collaborative way.
And Chuck, that's a great point too, is that dealing with those individuals on the mental health front, I mean, that's all the way from school kids that have been taken out of their routine, all the way up to individuals that are dealing with, addiction issues, to, all sorts and everything in between, to be able to get that assistance in working with your crisis center and as many people as you can. And then we went through, the clergy and faith-based organizations to get that word out, and also, the newspapers, radio stations, anybody that we can reach out to get information out into the community, especially for the significance of this virus in the, the minority communities. And that's a great point.
And if I can just jump in for a moment to also say, piggybacking on what both Chuck and the mayor said, as it's the time that we have to reach out and be proactive in reaching out to all organizations. It's kind of late to develop relationships at that point, so hopefully you've already had some of those relationships developed previously, but really faith-based organizations, our medical community, our homeless advocates and advocacy and public health. We're continuing those relationships, and we have our Seattle Police Foundation and many other police supporters that we've reached out to, and they have come to help us out in a whole host of ways with masks and other equipment. And it's really an opportunity, while a challenge, to really cement those relationships. And everyone walks away feeling better about their role and their responsibility in this. And we're so much stronger together. So we keep reiterating that message over and over.
Good. Well, let me ask all of you about resources. We know that personal protective equipment has almost universally been directed to hospitals, emergency rooms, and EMS. And we've heard from some law enforcement executives and others that then what do they do about their own personnel? I know here in the Charleston area where I live now, the HIDA has a clandestine lab group that has personal protective equipment. And as you can guess, there's not a lot of Klan lab enforcement going on, and they've directed some of that personal protective equipment to local law enforcement. How are you all faring with the resources you need to protect your own personnel?
Well, I'll just jump in, Gil. Yeah, we're doing well. I mean, we started out a little slow, much slower than we would have liked, but now with the, Carmen mentioned the police foundation. Our police foundation has been incredibly supportive over the years, and they have, as always, stepped up to the plate with respect to finding donors who are willing to help support us with hundreds of thousands of gloves and pairs of gloves and masks and so forth. And so right now we are in a fairly good shape with respect to our equipment. Also Tyvek suits. I mean, with our detectives going in to handle homicides and that sort of thing, we want them to feel safe and be sure that they can minimize their exposure. So that's been helping as well. So we're right now in pretty good shape. We're replenishing. We have a monitoring, and we're collecting data and making sure that we know how these masks are used and so structured, put a structure in place so that can happen relatively smoothly. Our deputy commissioner for management and budget Chris has been phenomenal at sort of managing this whole process of the resources through the quartermaster, along with the quartermaster, and making sure that the distribution chain works properly, so that the equipment gets out there. It's no good if it's not put in the hands of the officers and then the others who need it, our school safety agents, our traffic agents, traffic enforcement agents, and so forth that are out there having contact with the public on a regular basis.
Mayor? I think you wanted to comment. Yeah.
Oh, just one of the things that I would like to bring up is, we don't have the equipment that we need here. And that's one of the things I have an emergency policy group meeting that I'm going to have to jump off in a few minutes to get onto, but we don't have the necessary PPE for our first responders. And that's something we would like to go to, or I would. The mandatory wearing of masks went out in the public, but that's going to necessitate 2,500 a day. So, not sure that just for our essential personnel. And another thing too, that I think everybody needs to be very wary of is the fraud aspect of all of this. And with the PPE, I said, in Florida, we don't have basements, but apparently everyone has realized that they do have a basement and it's full of N95 masks. So, there's so much fraud, and all of a sudden everybody's coming out of the woodwork with this, with these supplies and, wanting payment ahead of time. So I would just caution everybody to be aware of that.
And Gil, in Seattle, we're doing pretty well with our personal protective equipment. Again, we were the epicenter, so we got on very early with trying to secure the equipment that we needed. We had donations from community members, from businesses, a lot of folks donating the N95 masks, plus our own supply. And then we immediately set up, believe it or not, that incident command system. Both of the police operations center, the emergency operations center, working with the county and with the state. So we had that line of logistics communication for not only other areas of the city, but particularly for first responders and essential personnel. And fortunately, we've been able to keep a good supply through continuous work, but it's been very streamlined and pretty efficient, having set up that integrated incident command system.
Gil, one of the issues that I think is still a national issue is the testing issue, is the ability to test first responders, firefighters, emergency medical people, even clerks in the grocery store. As you look down the road and you think about, well, what's the next chapter? We will be running a story talking to the Italians because they're about 3 weeks ahead of us, and as they think about resuming normal life, one of the things will be, how do you test people? Because, simply taking their temperature, actually, they don't take their temperature in Italy because you have a situation where a lot of people are asymptomatic. And so you don't show any signs. So they don't think taking the temperature is sufficient. They would rather have their people, in masks and gloves and so forth and constantly cleaning. But I think the testing part is so huge as we think about the future. How are we going to resume normal life? And if you look at what the South Koreans do, they test all the time. And they've been able to control things and get back to some kind of normal situation. So, we've advocated that first responders and people, truck drivers, whoever bringing food in, they should be at the front of the list. And we should be thinking down the road, where would we want to be a month from now? How are we going to get back to a normal kind of existence? And in order to do that, we need to be thinking now about how we're going to, test people quickly, get them back out, get them working. That's what we should be thinking about now.
Good. And I think right now we're going to take these last 15 minutes or so. And Mayor, we appreciate however long you can stay, but I know you've got a lot of other responsibilities.
Thanks, Gil. I'd like to just say one thing prior to signing off here, because that is an incredible point that Chuck brought up about the testing, is that we've really lost the battle on the testing. And one of the things, and now I just saw where there's ideas of the feds are going to cut off the funding for the testing site. One of the things that we're looking at, and we've already ordered, are the antibody testing kits to see who has actually been through this and now has a level of immunity, so that we can put those individuals back at work, whether they're taking care of the high risk in health facilities, ALFs, or nursing homes, or our first responders back on the street. So that's going to be a major focus for us right now, is getting as many people tested as we possibly can with those antibody testing. So I thank all of you for everything that you're doing to help our community on a daily basis. And if I can ever be of assistance in any way, you guys all know how to get a hold of me. So thank you all very, very much. Take care.
Thanks, Mayor. And Abby, we'll turn it over to you for
Thanks.
questions.
Wonderful. Thanks so much, Gil, and thank you so much, Mayor Castor. We have lots of great questions coming in, and we're going to do our best to get to as many of them as possible, and I might be combining some as we go along here if you're watching the queue. But one topic that's come up from a number of our listeners has to do with, other than PPE, steps that are being taken to protect first responders and law enforcement officers in situations where they might be exposed to COVID-19. So are you taking any steps in your jurisdictions to inform first responders or law enforcement officers when they may be responding to a call where a family or a household has tested positive for COVID-19? Is there information that is getting from your departments of health or public health to your first responders and to your dispatchers to guide those responses?
Hi, Abby. This is Carmen.
Well,
I can start on that with what we're doing in Seattle. You know, any call where there's been a COVID positive response, we have a heat map that shows where those calls are occurring. So if there's a repeat call there, we'll know immediately to put on the call before an officer is dispatched that it's PPE required. Besides that, every call that comes into our 911 communications center, the dispatcher, the call taker will ask 3 health-related questions to them about, you know, has anybody been sick? Does anybody have a fever? And a couple other questions before we send an officer to that location. And again, that would be a PPE advised deployment of the officers. And, you know, in any call that's not a priority, a high priority call, we're taking most of those calls online through our CopLogic or telephone reporting system, so that officers aren't having to be dispatched to as many calls in the field. And then when it comes to their personal protective equipment, we're ensuring that they have the gowns available to cover them, you know, completely if needed at these calls for service. And we had to get a special waiver because, you know, we still have a consent decree in our offices where body-worn camera and donning the gowns covers the camera but not the audio. But we made sure that the officers had the ability to be fully, you know, covered when they go to those particular types of calls. And again, we're tracking where those calls for service are occurring so that they know when there's a risk. And I would add that, you know, the cleaning of the facilities, we have routine cleaning, but we've increased that to multiple times a day, staff coming through, doing additional cleaning in all of the facilities that the department resides in. And then we have especially, like as most people, especially trained sanitation. They're certified, a sanitation team that comes in and does specific deep sanitization if someone is found to be COVID positive in the area. And so with that, and taking temperature checks on the way into each facility, as well as providing that information to calls for service, I think it's done a great deal in limiting the exposure of officers in the field.
yeah, I would agree. I think this has been, we are, like Carmen is doing in Seattle, is paying attention to the information that our officers have before they respond to a particular job, particularly 8 cases. And so they have that information. We're thinking about how, when they arrive, making a decision, they have that information. Maybe they don't go into the location, into the apartment, into the house, and have the people, depending on what the job is, come to the door. If they don't have the information, haven't gotten that information from the dispatcher. So they are wearing certainly the PPE, they have the masks, they have the gloves. Most recently, we advise that, and we haven't provided them, but we will, goggles, because sometimes in certain situations, officers are being spat upon, and fluids in the face, in the eyes, and so forth. So goggles are going to become part of the necessity, in fact, as this has evolved. And like Carmen, in the cleaning aspect, we hired 150 new custodians and cleaning team, and created clean teams that could be mobile to move around to particularly locations where our officers are working out of commands where officers are tested positive, and to go in and clean those precincts, wipe down the locker rooms, the entire building, and so we have enough of those people working and in the proper gear, the Tyvek suits and so forth, and supervised properly so that they don't put themselves in harm's way, even as they are disinfecting our locations. In addition, certainly, it's not just about the officers, but it's also about the civilians. And so getting them out of the workspace and cleaning the workspace in the administrative offices as well. The clean teams do that, and the custodial staff in those respective facilities do that as well. So we're trying to do as much as we can to make sure that the officers are getting the equipment they need, that they're getting the information they need, and to minimize the impact as they do their work. Yep.
Thanks, Ben. Abby, another question?
Thank you. We have received a number of questions on the topic of domestic violence and potential victims of domestic violence. There's much concern that stay-at-home orders could impact domestic violence rates. What are you seeing in your cities, and are you taking any special steps to protect victims?
I touched on this a little earlier, but we've seen a 23% increase in domestic violence calls for service. So a couple of things that we did, we put out a public service announcement with one of our assistant chiefs, Chief Deanna Nolette, talking about the fact that being at home isn't always safe for every person. We reiterated that video. We have a daily video message that we send to the troops. She reiterated that message there. We reached out to all of our domestic violence stakeholders and partners throughout the city, ensuring that the 24-hour lines are available, the contracts with the hotels are available. Any additional, we have domestic violence kits placed at each precinct so that each officer, if they're going to a call, they can either bring that with them or return if needed to make sure they have the appropriate referral and can get people the transportation that they need if they need to get out of an immediate situation. So the follow-up there has been pretty intensive. We've included our community partners and stakeholders in this, again, because we were monitoring all of our calls for service, but we did see a pretty significant increase in those types of calls for service. It's really important just to focus on the messaging, and then as we're responding, making sure that we have a swift and decisive response to protect the victims of domestic violence.
Thank you so much. I can ask our next question. This one comes from the
domestic
chair.
Violence calls are a priority for us as well.
That's a great point. Thank you, Deputy Commissioner. Our next question comes from Lori Robinson, the chair of the Council's Board of Directors. going through this experience, if you could look down the road 5 years from now, in what ways, if any, do you think that this crisis will have changed policing in your jurisdiction or nationally?
I think that's a great question, because I think a lot of police chiefs are asking that question now. We're seeing with technologies playing a role. We're seeing, ways that calls are handled differently. Can they be handled well that way? Something saw up in Toronto, which they're switching to one officer vehicles, response units. In some cities that would be problematic, but they're doing that because it's better for protection for the officers from each other. I mean, that's the hard part of this story, is that like in Detroit or New York City, officers are infecting each other. And how do you keep them working together but separate and safe? So I do think, there are things that we're seeing about this that will change policing. And I think that's a really good thing to be thinking about now.
Yeah, I would agree, Chuck. Yeah, I would agree, Chuck, that's absolutely true. And we are seeing, even as this has been a very fluid process in terms of managing in this environment. And so there have been a number of places in which points along the way where we know if we capture information, capture the data, that we will benefit from and have benefited from, and will become part of our permanent practices and procedures and policy as we go forward. And the notion of the two-car officer, I'm not sure that we can step away from it, but it is something we have to be aware of, and be able to think about how down the road how we're going to get the work done as we go forward. But we also, just in terms of policies and in terms of how we make reasonable accommodations for people who are at risk or maybe at risk, and how do we make that process an easy one so that you can make the application and get the approval, or maybe be told that you don't meet the basic requirements and so forth. So there are just any number of ways in which we're going to have to pivot in order to perhaps weren't prepared for this time around.
I'm going to jump on one just very quickly on that, because Chuck brought up a very good point about the technology. Even having this meeting would maybe not be something that would have occurred. I've done a number of these now. So I think we're using technology a lot more efficiently. We are pushing ourselves into the 21st century on this issue between Zoom and Skype and all the other functions. I feel like I'm becoming a quasi-expert. We also are putting videos out a lot more to our personnel. We did two-way streaming on the to get information out to people. I noticed that Commissioner Shea had done that as well at NYC. So I think we're going to rely on technology a lot more than we have before. To communicate with one another, to be efficient in some of these corners. So I think it's going to change the way we do things, and certainly calls for service, because we're limiting our calls for service. We're realizing there's probably a lot more that we can do online that doesn't require an officer with a gun and a badge and pepper spray and all those tools to take the information. And when there's evidence, video evidence, people can just take a video and send it to us. Again, technology plays a role in that. So I think we're going to become a lot more efficient with use of these things, because we've been pushed to be to be innovative in that regard. And then employee wellness, which was already on the horizon with all the officer suicides, but that is really going to another level because there's extreme anxiety when you have people coming to work every day in this, COVID-19 environment, contacting each other, contacting people in the field. And so the wellness aspects of having psychologists available and on board, making sure that you're reaching out to employees. We have contracts with hotels so they can just stay there just to decompress if they need to, but also if they don't want to come into contact with a vulnerable family member or if they themselves are sick. So there's just a lot of things that we hadn't considered before that I think will be part of our normal operational planning moving forward.
Well, I'm sorry that I know we have a number of other questions, but we're running out of time, and let me turn it back to you, John.
Well, thank you, Gil, and thank the panel for such an incredibly thoughtful and informative discussion. Thank you for your service as well. I think above all, stay safe and healthy out there. And as we noted, today's call was the first in our council series of web calls next week. It'll be COVID-19 in the court system. Same time, same channel, Thursday, April 16th at 1 p.m. A little bit later, 30 minutes, not 12:30, but 1 p.m. next Thursday. We have confirmed California Supreme Court Justice Kantil Sakauwe and Justice Mike Boggs from Georgia to be on the panel, with many others coming. Have yet to confirm, but we know we'll have 2 or 3 others to fill out those who serve in our courtrooms and are on the front lines there as well. So please check us out on social media, Twitter, our website, and other venues to see some of the after action reports from this panel itself. And see you next week. Stay safe and healthy.
Great. Thank you so much.
Thank you.
Thanks, everybody.
Thank you. Thank you.
Thank you.